We may differ in race, appearance, nationality, beliefs, and religion, but we equally aim for one thing: a healthy body, and to live efficiently. This is the reason why MSF is established.
The Médecins Sans Frontières, or Doctors Without Borders, is an international non-profit, self-governed, and member-based organization headquartered in Geneva. The organization has proven its calling to combat diseases in conflict areas as guided by its mission and vision statements since 1971.
The organization has gained recognition at a global level due to unmatched standards that it has set. It is reputed as one of the most dedicated, neutral, and passionate organization that will go out of its way to provide care where it is needed.
The Médecins Sans Frontières, or Doctors Without Borders mission and vision revolves around putting an emphasis on being a global leader in the provision of health services and on the importance of sacrifice and dedication to combat disasters and give reprieve to the victims wherever they are, to provide impartial medical relief to the victims of war, disease, and natural or man-made disasters without regard to race, religion, or political affiliation. This statement can be broken down into two components: improving health and improving communities. As a non-governmental organization, Doctors Without Borders has no limitations when it comes to where it can offer its services. They recognize how conflicts of war and natural disasters harm the quality of life, and therefore it commits all its resources to deliver medical humanitarian care to save lives and put a smile on those in need. Its mandate also goes further to the restoration of communities to better conditions.
Médecins Sans Frontières was founded in 1971 in Paris, France by a group of journalists and doctors during the wake of war and famine in Biafra, Nigeria. Now, the MSF team offers medical humanitarian assistance to save lives and ease the suffering of people in crisis situations in more than 70 countries. It is now a worldwide movement of nearly 65,000 members led by MSF's international president, Dr. Christos Christou, a medical staff including teams of logisticians, water specialists, and administrators which handle each crisis in various areas internationally. The MSF team also counts on the kind-hearted support of more than $6.5 million worldwide. Much of the Philippines is mountainous and prone to natural disasters. And so in 1987, the MSF started projects in our country. One of their featured projects was their response and recovery missions for 2013 Super Typhoon Yolanda. In 2017, they conducted counseling and distributed hygiene kits among the survivors in Marawi City. In the same year, they immunized 25,000 pre-adolescent girls against cervical cancer. Now in the COVID-19 pandemic, MSF supports 3 health centers in the area of Marawi as they provide mental health care, treat non-communicable diseases, and provide free medication in Mindanao.
The Médecins Sans Frontières, or MSF, provides medical assistance to people whom are affected by conflict, epidemics, disasters, or exclusion from healthcare. Their actions are guided by medical ethics and the principles of impartiality, independence, and neutrality. They give priority to those in the most serious and dangerous of situations, with its primary purpose to save lives. MSF believes that all people should have access to healthcare regardless of gender, race, religion, creed, or political affiliation, and that people's medical needs outweigh respect for national boundaries. Their goal is to advocate to governments, non-state armed groups, UN agencies, and other influential actors to highlight the plight of populations in danger and galvanize them into action. For example, to open humanitarian access to people who are cut off from aid, or to push for lower costs for essential medicines.
The Doctors Without Borders ensures a quick, responsive service in times of emergency. By contacting 911, the National Emergency Hotline directly calls the respective medical staff to rescue. As for the MSF Philippines, they can be easily reached. To further know about their projects and medical missions in the country, they have an official website, msf.org/Philippines, a Facebook page, facebook.com/msf.philippines, and email information at manila.msf.org. The scope of the organization has widened across the world, that each country has their own page with communication access in the general official website, msf.org.
Behind everything they do on the frontline system is an efficient logistics system. It is based on the principle that MSF staff should always have exactly the right materials for the job at hand. This is the same in urgent emergencies when material might need to be on plane within 24 hours. As for a long-running program, where a steady supply of equipment and drugs is vital. In many countries, national healthcare providers and other medical care providers are struggling to ensure a steady and reliable supply of the various items and equipment needed to ensure protection for medical staff. Surgical and FFP2 masks, goggles, medical gowns, and other equipment. MSF also encountered difficulties planning for reliable PPE supply for its project across the world. This situation is not only hampering efforts to contain the spread of COVID-19, but also the ability to continue to provide other essential medical services such as surgery or treatment for patients suffering from measles, tuberculosis, and other infectious diseases. Still, MSF is beyond grateful for their donors who continues to support the organization despite the continuous economic difficulties, as these doctors take their oath that they will be dedicating their lives on the health and safety of humanity no matter what.
And so we, the youth of this country, are wholeheartedly encouraging doctors, nurses, and medical practitioners to take part on Medicines Sans Frontieres Philippines
To be an MSF donor or volunteer.
Together, let's take action on what every person is yearning for: a healthy family and a better world to live in.